Autism sprinter, think equity, yeah. It's time to give the power back to the people. We're fighting to make our beliefs equal. Look at the failed policies and how they treat you. We got strength, yeah, we're far from feeble. This is for anyone with autism or a disability. Time to unite, show them how strong our will can be. Move readily, we're promoting equity. A non-profit platform, that's the recipe. Now throw your hands up, we finally got a winner. Think equity with Autism sprinter. Now throw your hands up, we finally got a winner. Think equity with Autism sprinter. It's time to make a change. It's time to stand up for what we believe in. Equality and equity across the board. No matter your race, nation, or creed, disability, or your needs. Yes, it gotta be equal. It gotta be right.
Hey everyone, welcome back to another amazing workshop in the Stabilize Me series. I mean, I get really excited when I talk about Amy Weinstock and all the work that they've done. And most importantly, I always want to give credit where credit is due. So it's really emotional because if it wasn't for this woman and accepting who I am as a founder of an organization and what I bring to the table, I wouldn't be where I am today as far as making headways in some spaces and getting funding. So if it wasn't for Amy, we wouldn't even be advancing some of these conversations and making sure that the Black and Brown community and those in marginalized, oppressed communities have access to the most basic necessities, which is insurance, and how to really navigate those systems. So without further ado, I want to introduce Amy. And if you guys have never heard of Amy, I need you guys to get right because of her work, most of us are the reason why receiving in-home ABA services. So I want to introduce her. I want her to tell you who she is, what she started, and why we're here today, and her continued work in addressing the insurance maze. Because I don't know about you guys, but dealing with insurance is like being in a toxic relationship with someone who just does not want you to get healthy and does not want you to get right. So I'm going to bring her on so she can introduce herself. And, I'm excited, y'all. So share.
Whoa. Jahira, I've known you for a long time, but that was quite an introduction. And I am the director of the Insurance Resource Center at Umass Medical School, which is an academic teaching institution. We don't usually kind of have those introductions, but I'm so happy to be here and work with you. And I'll address my kind of thoughts on equity and on your comments about the insurance industry. I have a daughter who's 24. That's what got me into this work. And she was diagnosed when she was 2. There was plenty of equity then. There was no coverage for treatment. So we were all in the same boat. It didn't really matter. I, from my background, and at the time I was working in business in the financial services industry on the regulatory risk management side, it just struck me that it was wrong. If my child had been diagnosed with cancer, my insurance would get me access to intensive treatment that might give her the best chance, but she had autism. So I got some good services from early intervention, which was unusual at the time, just given the age and things. But then she turned 3 and we went to our school, which again was supposedly a good school. And it is a good school, but good district, but with lots of resources. But the stuff they were teaching her and how they were doing it didn't look and smell like what I was reading about in the research and the intensive early behavioral treatments that can make such a difference in everybody's lives. So that's kind of where I was coming from, and you have these aha moments. And I remember my daughter, I have some nieces who are a similar age, and they're in preschool and they're like sitting in circle time and learning to raise their hand. And sitting in circle time is not a strength of our kids. And but I remember we were having some IP meeting, and they talked to you very slowly and I said, shouldn't we have a objective to raise your hand? Like, it seems to me that's how you learn in school. And they just looked at me like, oh, you don't need that. And I realized that we were being funneled on a track that our expectations were managed, and there was an expectation of, accepting mediocrity and nothing more. That was just very different from where I come from. So I don't know anyone who fights more fiercely than Jahira, but I think we share a little bit of that DNA. So when I'm just giving this background so you know where I'm coming from, because I am slightly crazy about this stuff. So when my daughter was about 6, I decided I was going to leave the workforce to pursue that work-life balance. If any of you, and I feel very fortunate that I had, the ability to do that. But if any of you have ever tried to achieve a work-life balance, let me just tell you, it's a myth. And I don't know how many women or men are. I think it's something that falls more on women to even think about. But that being an aside, since I was leaving the workforce and I was going to have more time for my daughter and I was going to have that work-life balance, and I thought I won't have much to do, I said, I'm going to try to see if I can take the professional skills that I had through my work on and decades of doing regulatory work and risk management work to figure out why insurance basically is getting away without covering this, and what we can do about it. So fast forward 16 years later, my daughter is 24 and thriving, and insurance is required to cover autism treatments. And I am very privileged that I had the opportunity to lead some of the grassroots efforts that passed some of those laws. And, we caused a bit of trouble. And in addition, and I've always taken my kind of life in one step. So I was very focused on getting those laws passed, and it's a Herculean thing. And I wish I could talk for the whole hour about that, because it would make a great movie. But but you'll have to wait for the movie, because I want to talk about how you actually get the treatment. So we passed these laws. There were actually 2 of them. I won't get into it, but it started with a requirement and a mandate for private insurance to cover treatment. And then it was followed a few years later with a public equivalent that got the Medicaid Mass Health population on board. I'm using some of these terms because I don't know if people here are all from Massachusetts or not. And if you want to type in the chat and introduce yourselves, I'd love to see who's here. And I also, if you have any burning insurance questions. But before the ink was dry on the first law, we realized that there was so much work that was going to need to be done, because this law was really system changing. We got some flack because it was only covering a percentage of private insurance plans in the state, but that was all we could do. And legislation and change is incremental, and it can can take a really, really long time. But that's the process. It's checks and balances. It makes it right. I guess I have a little more appreciation for the deliberate and slowness when I saw things going on in the last 4 years of national administration, or 5 years, where there was an administration that maybe was trying to dismantle some things that were of concern. So before that, I used to chafe and just want to do everything tomorrow and quickly. And I was thinking, maybe it's good that it doesn't always go so fast. But we're doing this a long time. But I'll tell you, it's 10 years since the first insurance law went into effect. And one of the key things, and this was revolutionary, besides having to cover autism treatment, it had no visit limitations, no dollar caps. And there is one insurance plan that imposed a cap on speech limits, and we worked with them, and it wasn't particularly hard. It took a little time, but we said, look, here's the law. Maybe you aren't familiar with it. You can't have this for autism. I personally think they shouldn't have it for any treatments, but for speech. But they said, okay, yeah, we get it. They took them out for autism. It's in their policy manual. And, last night we got an email from a family saying, my speech therapist just told me I only have 5 more visits left for the year. I didn't think there was a limit. So it's like, it's still right. So it shouldn't be so hard. And you just scratch your head. So we started the Insurance Resource Center. And for me, it was like dying and going to heaven if you're a policy geek. You can work on this legislation, then you get a front row seat to watch all the trouble play out. And we get to help. And that's just the coolest thing, because I still know from where I came, and I was that mom, and I felt powerless when they're like, nah, we don't have to worry about helping you raise your hand. And I knew that, you represent communities and work with communities that have been underserved and have so many challenges. And I was coming from a place of privilege. We had a lot of things at our disposal that others might not have to kind of fight the system. And it took every ounce of that, and it was so hard. So happy to do what we do, and really happy to have these connections and the opportunity to work with all of you. So now
I'm going to put up the slides, guys. I'm going to be behind the scenes, soak this all in, because this information is wealth of knowledge. And parents, please write down questions, put them in the chat, email Amy, because our kids need all the supports that are available to them. There's policies in place, like Amy said, that we need to utilize and making sure that we maximize all the help for our babies. See you guys later.
So this is going to be like a drink from a fire hose, and I'm going to go through it, and you may not understand it all. Stephanie, thank you for being here, and your comment about your friend needs to get her child tested. That is one of the biggest challenges. So I am, and it's always been hard from 20 years ago when we had to wait a few months to get an appointment for diagnosis, when our early intervention team was like this. They were more polite, but they're like, this is autism. And it's only gotten worse for a lot of reasons. Some of it is the prevalence. The system is still very, very hard. And COVID has made it particularly difficult because there have just been so many children over the last few years whose lives have been disrupted and haven't had an opportunity to have early intervention services or go to preschools, and we tried remote, and it kept some of the wheels on the bus. But there are all these children kind of showing up in school now and in the system that have autism, suspected autism, other issues, and the systems are strained beyond belief. So my advice, from an insurance perspective, insurance should cover the testing, getting that testing, getting that appointment and that evaluation is maddeningly hard. So what I would say is, don't give up. So you call clinics and they will say, okay, we'll put you on a wait list. Although I've heard some are even saying their wait lists are closed, but they're saying it can be 9 to 12 months. Say, thank you very much, even though you want to, wring their necks, and because it's not their fault necessarily, but say, look, if you have a cancellation, I will be there. Please put me on a cancellation list. And cancellations happen. There's a really respected clinician, and I was leading a task force last week, and she said, I can't be in the meeting because I'm seeing patients. And then all of a sudden she showed up on the Zoom screen. She said, guess what? My patient got COVID. Now, I think that was like 8:30 in the morning, and she got a message at 8:25. That's a little hard, but if you ask to be on cancellation lists and you can make yourself available and you call every few weeks and say, is anything opening up? They know that when they get that call at 2 in the afternoon or 3 in the afternoon, that the appointment the next morning is not going to happen. They can call you and you will drop everything and get there. And honestly, that's how we got our daughter diagnosed 20 years ago. And it's still the case today. And, get on several. I'm going to say something really strong I think children who have autism and suspected autism should get thorough examinations and workups, because we still don't know what causes it, but we do know that there are many underlying neurological, biological things potentially going on there. And so the criteria for autism are set of observations, behavior. You can't diagnose with a blood test or an X-ray or other things that make other maybe things easier to diagnose. But so I wouldn't say it's like finding a needle in a haystack, but you should get those workups, but that can take a long time. The requirements to access insurance funded services, both public through Medicaid and through Mass Health, are a diagnosis by a physician or a psychologist, period. Not a neuropsych exam, not a neurologist, not even a developmental pediatrician. I think those are people you want to see and you want to have on your team working with you. But if if you know, if in your heart, if your team is saying, look, this is autism, get a diagnosis from whomever you can, who is, qualified to sign that paper. I don't say that lightly. And, that's what we did. And then a few months later, we got in to see the neurologist that we currently see today. But, do what you can. What we also see happening is there are some providers, like say you have that diagnosis and you're seeking ABA and you have a letter from your pediatrician who are saying, sorry, you're not going to get insurance approval until you have a full neuropsych exam. They're sending parents away. That also is not true. So the banner going across the bottom of the screen that has our phone number, contact, reach out to us, get a hold of us. We can help you. That doesn't mean a pediatrician can write a letter the way they might for a different condition, like say, Amy has strep throat, she needs antibiotics. They can't do that. They have to, and we do see that unfortunately, where they say, Johnny has autism and he needs 20 hours a week at ABA. They have to be qualified to diagnose or to discuss it or to delineate it. But we have seen where the pediatrician said, I've known Johnny for 3 years. He presents with signs of autism. He's had psychological evaluations from the school district that maybe doesn't diagnose autism, but notes deficits in this area and social communication and this, that is enough to meet the criteria and say, this child has autism and needs services. So we spend a lot of time, many days, like working with people on that. And we have a whole presentation on diagnosing autism, which shouldn't have to be that hard, but we are seeing that access to diagnosis and the diagnostic criteria being a barrier in accessing treatment that's already hard to access. So we're pretty passionate about that. So today I'm going to speak just an insurance overview. Some of the acronyms we use, ERICA is the acronym for the private insurance law, mass health coverage. There's also, if people on this don't have a loved one with autism, but you have a child with other issues and need behavioral health, there is a lot available for behavioral health, both under private and mass health insurance. Accessing treatment, it's one of the hardest things that I might spend most. And then if I don't get to the end of this, the last two, the effective insurance coverage on IEPs, there should be no effect. If anyone is going to an IEP meeting and saying, gee, we're really struggling, we could use in-home ABA covered by school, that's how parents accessed ABA the only way before. These insurance laws were in effect. That is still a requirement, and especially where it's so hard. If a school says, nope, there's insurance, you go use your insurance for that. That is not okay. So it's a little more complicated than that, but the fact that in the last decade, insurance has expanded to cover a lot of treatments should not be affecting what a school covers under an IEP. And then in terms of telehealth, it is still available. It's still being covered. So that's probably here to stay in some way, manner, shape, or form. Personally, I'm for a lot of autism therapies, for a lot of autism patients, I don't think it's the best way to deliver it. Currently, the general feeling is, there's laws and regs that allow it to be covered, but what we expect and hope is that telehealth is covered situationally, is at the request or preference or needs of families. It's not being used at the convenience of a provider who's like, well, you need services and in-home would be better, but I don't really feel like coming out in the snow and going to your house and this and that. So we will offer you only telehealth. That is a concern. So that's the overview. If you're not able to stay for the whole thing, let's go to the next slide. So this is our center, which the information down there is below. We help thousands of people each year. We have a website, we have a phone number, we have an email. Our main thing is information and technical assistance, and we provide assistance with all issues relating to accessing insurance coverage for treatment. And we are not a, mass health center or that's not our role, is to give you help with sort of mass health coverage, but because the system is so confusing and people run into problems and we will get calls from people like that their Mass Health is messed up or it's not showing behavioral benefits or something has gotten. We do help with some of the troubleshooting and issues. We have a great website. It's not super sexy, but if you ever can't sleep at night, just download our fact sheets and read them. You'll get good information. And then we do lots and lots of trainings because that's how people get the information. So the one thing to just note is that our services are free. We do not charge. You can call us once, you can call us 10 times. We are happy to help. And the other thing that we are known for is we are responsive and we get back to people. As a parent, I have just been on the other end of way too many unreturned phone calls that we have a great team and we all work really hard and we all have lives and things get busy. And, I'm a pretty flexible person about a lot of things, but I'm not flexible about not getting back to people. That's kind of what we're committed to. Next slide. So, Stephanie, I would recommend if you're looking for resources and diagnostic stuff to reach out to our center. The phone number and the email are at the bottom of the screen here. And we will have someone try to help you specifically. So as Shahira said, this is so confusing. And so in layman's terms, what we do, everybody has an insurance card. This is from a certain state, not Massachusetts. And then there's laws, there's regulations, all this fine print. And it's pretty hard to figure out what your insurance actually covers, unfortunately. Nothing on that card that's highlighted, those arrows points to say, how do I get an ABA therapist to my house to help my kid? And even more confusing is there could be two people on this show who have the same exact insurance card and you could have different coverage. So, go figure, it's confusing. Next slide. So what we do is we help people figure out where they're starting, what their insurance covers, if it covers what they need, how you actually go through those steps to get the treatments that you need, and then everything along the way. And we help the whole community, families, providers, clinicians, even, the state agencies and regulators, the good and legislators. The good thing about our center, we joke that we're complaint central. There aren't too many people who pick up the phone and say, I just want to call and let you know that everything is going great. I'm getting the therapy I need. It's working well. My insurance is covering. I'm having no problems. There are actually some of those people out there. And if you know them, I'd love to meet them. I do from time to time, but people call us when things are going bad. And we don't take data the way you might hear about clinicians or ABA and this and that, but we do take notes. And so when we see the same issue, you might be hitting just a huge barrier of that, that speech limitation, and you're tearing your hair out and you don't know what to do. When we see that multiple times, it's a red flag to us that, there's something that has broken down in the system, and we can take that data and we can bring it to the agencies and the regulators and the legislators to say, maybe there's something that needs to be looked at a little more closely here that can resolve this issue, because so many families are facing that. And that's been helpful. And we're happy to do it. And it brings me back to sort of where I kind of started my work on that kind of regulatory risk management side. There's a way to talk to people. And over the years we've been doing this, there have been several big issues that we have been able to resolve, through that process with the data that we have. That, there are great people in this Commonwealth and in this, I really want to help families. And lots of those agencies have consumer bureaus and complaint places where you can file them and stuff. But where we are so focused on treatment for autism and behavioral health, and many of the people on those, they don't completely understand the nuance. So you can say, my insurer is denying the authorization for the neuropsych, and they're saying it's not medically necessary. The person on that other thing is, they don't understand medical necessity, and maybe there is a legitimate concern with that. When we go to them and say, we have seen, 7 cases of similar denials, and it's only happening with one insurer, and these families are really frustrated, they can kind of look at that and say, maybe something's wrong. And I remember a regulator calling me once, and they said, we can't assess what medical necessity is. We can't do this, but they said, we reached out to the insurer, and the insurer said, oh no, we don't deny every request. We've approved like 30% of them. And the regulator was like, okay, I don't know medical necessity, but if you are denying 70% of the requests that are coming through, we need to talk. Something's going wrong here. So that's, that's the kind of absurdity that we see, because if there's a law requiring something to be tested to be covered and 70% of the requests are getting denied on medical necessity, maybe there's something with the medical necessity criteria that aren't quite looking. My daughter has had a lot of neuropsychs. I feel fortunate. They've been very helpful for informing us on what to do and stuff. I wouldn't voluntarily want those for the world. They are a wrenching, grueling, stressful process of cataloging the deficits. So if 70% of the people requesting those are not able to access them, that's the kind of stuff that we're dealing with. So Eunice is asking a great question. Is there an income cap to apply for Mass Health? And the answer is no, but I'm going to get into that in more detail. You may have called Mass Health and been told you're over income, you're not eligible. If you have a child with autism, they should be eligible regardless of income. I will say it's not free. So you have a child with autism, you may have an income that is above what would make you eligible for, say, Mass Health standard, but you would be eligible, but you might be assessed a premium for that. Okay, next slide. So as I mentioned before, everybody has different types of insurance. Even with the same card, it could be a different type of insurance, but it generally falls into three main buckets, and you just have to kind of know where you're starting. So there's public insurance. That's our Medicaid and Medicare plans. In Massachusetts, it's called Mass Health. In other states like Connecticut, it's called Husky. They have different names, but it's all Medicaid, although state Medicaid plans vary. So if you're tuning in from a different state, what I say about our Mass Health state Medicaid plan may be different than what your state plan covers. And then many people have private insurance, and those also fall into two main categories. And again, you can't figure that out from your insurance card, but the thing to understand is one of those, the blue buckets, the private fully funded, are federally regulated, and the red are self-funded and state regulated. And so the red self-funded plans are federally regulated. So for people like me who do this work, it just helps us figure out, which of those piles of laws you saw in the magnifying glass apply to your plan, and how do you get that? And the reason these circles intersect and overlap is sometimes people have more than one type of insurance, or sometimes in order to access coverage or optimize coverage or minimize the out-of-pocket and the copays, the right thing to do and the best way, or the only way, is to actually have more than one type of coverage. So what we fundamentally do is we try to figure out, if people don't know when they reach out to us, what insurance do they have, and does that cover what they need, and is having a different kind of insurance, or maybe moving into one of those intersecting circles, what they need to get where they want. So I'd say when we started the center 10 years ago, many people called us and they didn't really even know what they had. Most people today generally kind of know what they have. It's just a question of how to navigate through it. Next slide. I'm going really fast because we're late, but this might be confusing. It's a lot. So I recognize that I'm doing it a little deliberately to get through a lot of stuff, but I'm happy to take questions or follow up with people afterwards. So some of the frequently asked questions is, can a child have Mass Health and also have private insurance? Answer is absolutely yes, but we get a lot of calls from families who are told something different. The private insurance is always going to be primary. Does a child have to have an autism diagnosis to access ABA therapy? Again, the answer is yes, but if you don't have an autism diagnosis, you can often access other behavioral therapies. And then questions about, can you purchase a policy from the Health Connector that will provide access to ABA benefits? The short answer is yes, but you have to be pretty careful how you navigate through that. I'm not going to go into much more detail. Next slide. This is a really big one. If someone has Mass Health, do I have to maintain them on private insurance? Yes, with a capital Y. Mass Health is always the payer of last resort. We just yesterday dealing with a family, their trying to get behavioral health, and the behavioral health provider said, just drop your kid from private insurance. Mass Health is going to get you what you need, and the private insurance is a problem. For that provider, the private insurance is a problem, but for that family, if they drop that employer insurance that they have access to and they just stay on Mass Health, tomorrow it won't be a problem, but when Mass Health does their redeterminations and everything, it's not going to be pretty. And Mass Health coverage doesn't expire, but it's a lot of paperwork, and they do their redeterminations, and you have to stay on top of that, and you have to read the letters, and you have to respond to the requests, because every request will come. It's maddening because it's always by mail. It's dated, maybe 10 days before you actually get the letter, which isn't how long it should take for mail to get to you. And then it says, if you don't respond within this time, your coverage expires and terminates. And so when we get calls from people going, oh, my mass coverage, got canceled, this and that, many, many times it's that something got messed up in a redetermination. If you go to the next slide, Stephanie's asking, what age can a child be tested? Really, really young. So all pediatricians are required to do screenings at I think 18, 24 months, and maybe even 12 months, just developmental screenings. If those reveal red flags and referrals for things, they can be followed up. So we see very, very young children, sometimes even 18 months, it's getting 12 to 18 months, getting diagnosed with autism. I would say under 12 months, it's probably not, and I'm not a clinician, but it's not, my daughter's diagnosed at 2, they were like, oh, this is really early, even though we had been worried for like a year, and our pediatrician had just blown us off and said, no, I wouldn't worry about it. But it can be as young as a year. I'd say as soon as you're seeing signs, they can be tested. It's different kinds of tests that you do. But if anybody is saying, oh, he's a boy, he doesn't speak late, wait till they're 3, wait till they're 4, wait till they're 5, that is wrong, completely wrong. So ERICA is the law. I like to talk about it because I worked on the efforts to pass it. That's the first law, and that was the law that required private insurance to cover treatments. And it only covered one of those circles that I just showed you, but it was system changing, because before that was just never covered. And you would just, oh, well, autism, that's not covered. You go to your school for that. So this really changed the mindset and how people thought about it. And when I first started my advocacy work, people who were veteran advocates were like, oh, no, you don't understand. You're not going to get that passed. That's just not how it works. And I was like, look, again, I used the cancer analogy. If my child had cancer, my insurance would cover chemo. So why is it not covering this? That is the simple thing, but it took a lot. And my hair is sort of the same color, but it takes a lot more chemicals now, and I have a lot more wrinkles because of it. Next slide. So as I mentioned, it was a system really changing law, but it only covered that blue circle. And I don't blame them. People whose plans were in those other circles, including my own plan, which was, in the red circle, were really excited when the law passed, and not so excited the next day when they found out it's great, but still don't have access to the coverage. But what it did was it gave us a platform to do advocacy. So we could advocate with plans that were private plans and self-funded to say, look, this is a mandate. This is Massachusetts. You should really be covering this as well. And today, a majority of them are covering it. And again, the public plans weren't included, not because we did not want to, and all the issues that you face, people who only have public insurance and issues of equity, health, et cetera. But the politics were such that if we had put public in there at the same time, it would not have gotten passed. And what happened was that because the private was starting to cover it, it raised the disparity. So my very first call to someone at Medicaid, and now I have very, very close partners. We work very closely with them. In full disclosure, a lot of our centers funding comes from Mass Health because that's the population we work with. But in my very first conversations, it was, I think, an attorney, and what she said was, well, I don't really know what ABA is, but if it was really important, we'd already be covering it. So, that's where we started from, and we persisted. And 5 years after the ERICA law was passed, It was a different law, but there was a section added for Mass Health and Medicaid to cover ABA treatment as well. And today I'd say that is some of the best coverage. And in some ways, the coverage under Mass Health is, for many cases, better than what people are getting and less hassle than private insurance, which is why people are told to apply for it, or people are often told to drop their private insurance, and they can't. So next slide. So this gets to Eunice's question about, is there an income cap to apply? So there's several different types of Mass Health, and there's only one application though. So it's not like you have to know what type of Mass Health you might be eligible for and figure it out. You just apply for Mass Health, and then they determine eligibility and the type by several factors. So the first includes income, age, and then special circumstances, including have a disability, and as well as citizenship or immigration status. So you do not have to be a citizen to get Mass Health. Depending on if you're not a citizen, what your immigration status is, because there's many, many different kinds of non-citizen immigration statuses that might affect the type of Mass Health you have. And then further complicating it is immigration status that might give you one type of Mass Health that it is limited. If you have disability, can sometimes get you a different type of Mass Health that might give you. However, you do have to be a Massachusetts resident. We do sometimes get questions from families who might live in, say, New Hampshire or Rhode Island. They work in Massachusetts. They have Massachusetts private insurance. They want to know if they can get Mass Health secondary. You can't. You have to live in Massachusetts because it's our public system and our taxes pay for that. So Eunice, we have many families who are told you're not eligible for Mass Health, your income is too high. They might have even said to that person telling them that, whether it's someone from Mass Health or someone else, but my child has autism, and they're like, well, that doesn't matter. Well, it does matter. Autism is a disability and you should be eligible for it. Next slide. So as I mentioned, if you haven't heard me say it, I'm going to say, people with disabilities are usually eligible for Mass Health regardless of income. It's not free. Being eligible and being charged for it are two different things. So you might be charged a premium. Those premiums are calculated based on income, and they're a sliding scale fee. So it should be cost effective. And so, we will sometimes help someone through the whole process. They understand eligibility, they apply, and then they get a bill and they're like, what do you mean I have to pay for this? And, as I said, it's sliding scale, so it's generally cost effective. A lot of what we will do is we will explain to somebody how that works. And I wouldn't say it's secret sauce because it's public what those rates are. We will help someone sometimes try to figure out, is this going to be cost effective for my family before they apply? And there's a lot of factors that go into that cost effectiveness that we can help you. But just right now we're helping a family where they had Mass Health at a time when their income was lower than it is. Their income increased, and so they were told that they're no longer eligible, and they lost that coverage. And they have insurance coverage because they have employer coverage, but their son is really, really struggling with some behavioral health issues. And those Mass Health behavioral health treatments are key to helping him get where he needs to get. So, we're able to help them get that coverage reinstated. So I'm not sure who dropped the coverage for them, but that was just wrong, and it's troubling, but that's what we help with. And so there's lots of different types of Mass Health, but the two most common types we see are Mass Health Standard, Mass Health Common Health. And that's not to say you're getting a wrong type, but when someone comes to us, again, looking back to the circles, where are you? And they say, well, I have Mass Health, but I have the Children's Medical Security Plan, or I have Mass Health Family Assistance, my child has autism. That can often be a red flag for us that something isn't accurately reflected in the system. Usually the system hasn't kind of captured that there's a disability there. So we try to kind of work from that. And because we don't have access to the Mass Health systems, even though we can work with people to sometimes get a check and that verification, we can figure out, where someone is and what they need to get to. Next slides. Am I going too fast? So Mass Health Premium Assistance, I call this the best kept secret in the state. So there are lots of things in the state that help people access affordable healthcare insurance. And there's our Health Connector, and many people get policies through that are subsidized, that give them great coverage for rates that they can afford. Mass Health Premium Assistance is something that has been around for a really, really long time, way before any of the Affordable Care Act kind of mechanisms and stuff went in place. And it's on its surface logical. If you have access to private insurance, you have to use that first. You have Mass Health secondary. But if you're eligible for Mass Health and if your private insurance meets requirements, Mass Health will reimburse you for the cost that you pay for that private insurance. And it's based on the total cost you pay for your whole family, not just a pro rata for maybe your child with autism. So it's a hugely valuable benefit. Many people don't understand it. We help people understand it. We help people apply for it because it's a separate thing after you have Mass Health. And it, sometimes either cancels out the entire premium that is charged for someone to have Mass Health, or significantly reduces it, or sometimes people get a check every month for their private insurance. So we helped a family last year that pays a really high amount for their private insurance, which is not a bad thing because usually the more you pay, the more you get. So it's a plan that had very low deductibles, very low copays, really comprehensive coverage. And their family cost was like $700 a month. They were eligible for Mass Health because their child had a disability. They were assessed a premium of, I think, about $150 a month. So they basically, instead of paying $700 a month for their private insurance, they got a check from Mass Health every month for $550. Mass Health took the $700 that they were paying for their private, reimbursed them, deducted that $150 they were assessed based on their income. And, that can cover a lot of treatments and things for our kids. So it's really powerful. Some of the, it's almost amusing, but some of the funniest conversations we have or calls are someone, we help them through the whole process. They get this, they find out they're going to be getting a premium assistance check every month for like hundreds of dollars. And, I had a dad call me one day. He was sure something was wrong. It was too good to be true that somewhere down the line, someone was going to knock on his door and he was going to be in a boatload of trouble for getting all this and taking all this money. But it really is true. And it's logical. If you have a disability and you qualify for Mass Health, which makes them, eligible for them to cover all your healthcare costs, if it's cost effective for them to pay a $700 a month insurance premium, it's actually a better thing all around. Next slide. There is a comment in the chat that is in a language, I'm sorry, I don't understand it. So as I mentioned, this is about autism and autism insurance, and I'm happy to, but just remember, if you don't have an autism diagnosis, there are other behavioral health services you can get, both through private insurance and through Mass Health. And I'm going to, just for time, go right through this because I want to show you one more thing. So if you can go to the next slide. And these are the other behavioral health services that are covered. And Jahira, I don't know if you're able to post a copy of the slide deck on the on your channels, but we also have these discussed in more detail on our website. Next slide. And keep going. And some families, actually, if you can stay on that last slide for a second, some families with autism may be accessing behavioral health treatments through autism, but they may also access some of these general behavioral health services like mobile crisis intervention or intensive care coordination. So they're not mutually exclusive, although there are in-home behavioral health services covered under these kind of non-ASD services. You can't get duplicative coverage from both. Next. So again, these behavioral health services are covered under both public and private insurance. Next. Accessing treatment. We've already talked about accessing a diagnosis. That can be the $64,000 question. Sometimes just figuring out what your kid needs is really hard, because you can have two, 5-year-old kids with autism, and it can be the same as two kids who have a broken leg. What one child may just need, have it set in a cast and hobble around and they're playing soccer 6 weeks later, and another child could have a very complex break that needs surgery, a hospitalization, a long recovery, physical therapy. Autism treatment is the same. So, and it's sometimes hard just to figure out what do I need? And that's why you want to get to those professionals. That can be so hard to. You can also ask your school teams. You can ask other people who work with your child, but you figure out what treatments you need. Then you find a provider who accepts your insurance. That can be challenging, but you can call insurers, you can call providers, and then the provider requests the authorizations. And for ABA, it's two-part. They do an initial assessment and then they come up with a treatment plan. Next slide. Insurers are required to have adequate networks. It's a little bit of an oxymoron these days because they're so hard to provide it. But if an insurer is like, hey, yeah, we cover this treatment, but we're going to pay a rate that's super, super low, and there's no providers who will take that rate. And they say to you, well, we cover it, just because you can't find a provider, that's tough luck. That's not your problem, that's their problem. And we have had to work on that with some insurers. And you can call your carrier and request assistance and say, look, I'm having a devil of a time finding a provider. They'll first default will be like, oh, go to this list on our website and call people. But you can call them back and say, you know what, I've called, everybody on your site and I can't find anybody. Please help me. And they're supposed to help you. And if they can't, and you say, but I found this other provider and they have availability, will you work with them and give them a single case agreement? So it's not in their network, who cares, but they're going to work with your kid and do a contract. They can do that as well. So that's the kind of short answer. In theory, it doesn't always work as smoothly. Next slide. This is a cool slide, and we don't have time to demo it today, but there's a site for Mass Health called mabaaccess.com. And what's great about this site, every insurance company might have a list of providers. We have a list of things. Thank you so much. So this site, you can search for providers, but what's great about this is providers indicate availability. So Jahira, if you can scroll down, there's something called Youth and Family Services. If you can click on Find Provider Openings, and then I'm taking my glasses off, it's so small. Select the service, go to the dropdown, and they only added ABA like 2 years ago, and it's the most highly searched thing. So if you can, ABA, put in an age, let's look for an 8-year-old. And then put in a zip code. Okay. And then 10 miles of Boston is fine. If you're in a different town, you might make it harder. So what's really great about this is it gives you a list, which is what you'll get from anybody, but then it shows you available openings. Do you see that? So it will show you who has openings. And so if you're looking at this and you go down 1, 2, 3, 4, 5, and there's this one, Family Behavioral Solutions, 0 openings. They've never updated the list. You know what? That might not be the first place you call. But even if you go to the one above, Apex Behavioral Consultant, they say they have 5 openings, but they updated this 17 months ago. That may also not be the first place that you call. I wouldn't say you don't call them, but then you go up to the first one. They have 15 openings, and they updated it 5 days ago, and they say they have in-home and telehealth. That of course, they're saying Boston, and they're saying they have availability in towns surrounding Worcester. So that might not help. You go down to the next one, 3 openings. They updated it 2 months ago. You might call them. So it's a great great way to search, but I would say with anything, buyer beware. So we have a fact sheet, Finding an ABA Provider, and it has a link to something called 10 questions you should ask when looking for a quality provider. So you call this provider, yeah, great, we have someone who can help. You want to ask those questions. How do you work? Who's working? And again, you have to kind of use your gut instinct a little bit. And unfortunately, with the supply, the demand, there's a lot of new providers. There is a range of quality, and there's unfortunately some really bad quality out there. And you have to be really, really vigilant. And if you aren't happy, I always say to parents, like, go with your gut. And I know with my daughter, every time I was like, well, this doesn't kind of seem right, but I'm going to trust them or a professional. I just will kick myself because it can be bad. If you just want to tell you, there's one more thing about this site, which we didn't get into here, but I see some people commenting in different languages. You can go to the next slide. They have a little button at the top of it. Just keep going through it. That is a translate button. It goes to Google Translate, but you can select that database. You can select a language and you can search that database. And I did one of those. Yeah, if you go to select language way in the right there, very upper right under login, says select language. Can you see that button? Shahira. So if you go to the select language button, and I'm seeing things that look like they're in Cyrillic or something. So I would go down there and you can definitely do Spanish, but you could also do Russian or something, and it will bring up, and I don't know if that language is Russian, I'm sorry, but it will bring up that language. And the first time I demoed that, I did it for a group of Somali families, and I was really worried about what was going to come out of the computer, and they were not too optimistic, and it actually came out pretty well. So again, that's also a huge resource. If you call our center, we have ability, and we have a staff person who can facilitate Spanish language, but I'll be candid, we try to get people help beyond that, but we don't have as much. So we are at 11 o'clock, and I really want to answer questions. I can stay on. I think this was about the end of it. You can keep going through to the end. This is just all about how to use MABA access, the language access. You can access other treatments. These laws were not ABA laws, even though you hear a lot about ABA, and ABA may not be the right therapy for everybody. Again, this is just kind of insurance 101. I'd keep going to the next ones. Keep going, all I'd say about this is never give up. I use the analogy of walls. Every parent of a child with autism special needs, you're going to hit walls, whether it's getting that first diagnosis appointment, accessing treatment, getting a denial for things. We look for doors through the walls. There are many more doors with these laws. If not, we look for a way around the wall. Sometimes we have to look for a way over the wall, and sometimes we have to get a bat and beat the wall down. And I say that, we can laugh or if you think it's funny, but each of those comes with more pain and suffering and efforts. And, but if you're a parent, like, you don't have a choice. So we will help you as many times and fight as hard as we can't do the fight for you, but we can advise you and help you fight. And I guess one of the honors of doing this work is I have just met the most resilient, resourceful, determined parents in this journey. And, it's just really, it's what keeps me, motivated to fight the fight alongside them. Keep going through the next ones. I think we're getting to the end. Jahira, can you advance the slides? Again, this is if you don't have coverage or get denied, just keep fighting. Next slides. It shouldn't affect IEPs. There's a bulletin from the Department of Elementary Secondary Education. You can go to the next slide that says that. I was really excited when that got issued. Then I found out a lot of people don't read it, but it exists. We can get you a copy of it. So if you do get to that, school that's like, no, we don't cover it, we're happy to help you advocate there. We don't do educational advocacy. There are many great organizations that do that, but we can advise that insurance should not impact that. Next slide. Telehealth, as I said, it continues to be an option, but it should be at the choice of the family. And let's hope we don't need that too much longer. Next slide. These are some resources. The mobile crisis emergency services, they've been around for a long time. Again, they haven't always been as helpful for autism, but 2 years ago, the mobile crisis services, there was a resource developed specifically for mobile crisis teams to consult with when they get calls from families who have children with autism who are in crisis. And they have helped deter and reduce a lot of like emergency room visits, police calls, and other things. So that's a helpful thing. Next slide. Impact, as I said, people usually call us when things aren't going well, but once in a while we get a letter from someone who, is really grateful for our help, and the type is so small you can't see it, but that's a letter. And the next slide is the most important slide, which is our contact information. So I just want to give a shout out. As I mentioned, there's no charge for our services. We get a lot of funding. It takes a lot of funding to do the work we do. And I'm very grateful to those funders on the right who many of them have been with us since we started, although we have more now than we had before. And then my team, which is phenomenal. It used to be, we were always the Insurance Resource Center, but full disclosure, the first few years it was a center of one, and then it was a center of 1.5. And now we have, 4 team members, main team members, and then, a backbone behind it that allows us to do the work we do at the scale that we do. So to reach us, our emails are here because we want to be accessible, but the best way to reach us is through the main number, through the main emails, because as responsive and devoted as we are so busy that if someone emails me at, 4:30 on a Friday afternoon with something that is not maybe, a train wreck that, can wait till Monday, and they know it and we know it, and that's all fine. But Jahira knows I also am on the faculty at the university. I might be teaching and this comes in and I mean to get to it. And it's like Tuesday afternoon and I go, oh shoot, it got buried in all the debris that came into my inbox over the weekend. So that's why if you go through the main numbers, we have a system that kind of takes those and catches those calls, and we get back to people. I can't hear you, Jahira. I think you're on mute. But I can see your body language. So you're saying, thank you, that was amazing. Right, okay.
This is amazing. And I was sitting here taking notes. I do have a question because I think this comes up all the time. You know that oftentimes at special education meetings, the special education director or who's facilitating the meeting will give parents a form to sign that it's like mass health. Do you know what form I'm talking about? And what does that interrupt any services or anything like that for families?
So I know the form that you're talking about, and it's apples and oranges is what I would say. So it's something that's been around for a very, very long time. There's something called school-based Medicaid. And if a parent consents and signs that form, it allows the school to bill Medicaid for certain services. Beyond that, I don't know too much about it. If a parent doesn't sign the form, it doesn't affect the services that their child gets. So it's a family's decision, and it doesn't affect things. It just sometimes allows the school to get some reimbursement. Lots of families have questions about whether they should sign it, whether it might affect things down the road or otherwise. And we aren't really able to advise on it because it's just it's not related directly to the work we do. So we would say, talk to educational advocates, talk to other families. So, I've been in some meetings with, like SPED packs and school groups, and someone's like, oh yeah, I signed that form. And someone's like, why did you sign that form? You shouldn't have signed that form. Right. And other people are like, yeah, you should sign that form because it lets the school get, some funding back that they might not otherwise have. I don't think this is Amy Weinstock speaking. I don't think there's a right or wrong answer to that.
Right.
So
That's
all I know.
awesome.
That's all I know about it.
Because I always thought about it, right? Because I'm like, they tell me the same thing, and I'm like, oh, this made me think about it. But thank you for answering that question, because I think, again, it comes up all the time, and I sometimes, I don't think I've ever signed it because, one, I don't really trust the funding streams and how they use in schools and how they really help some of our babies, but then there's times where I thought about it and I'm like, oh man, maybe this can help my son get a little bit more services in the school. I'm not sure, but that's a really good answer, because I think it's really confusing.
You might want to have somebody come speak to your group about that.
Yeah. Right. And if you know someone, let me know.
I don't, honestly, because I've asked that question. I've reached out to people, and
no one knows. No one knows.
Well, it is what it is. It's a parent's choice, and yeah, I just don't. I couldn't answer it more than that. I'm sorry.
So I know we're going to end. How can we contact you and reach you again?
The last slide had our contact information. You can do a Google search, Autism Insurance Resource Center. Our material is at the bottom of the screen. I will note our services are mostly for people in Massachusetts, because that's what we know. That's where we are. And it is slightly state specific. So if you're not in Massachusetts, you're welcome to reach out to us. There are some like Amy Weinstock's in other states in the country, although there's not another insurance resource center like ours. So we can, sometimes connect you with someone or provide some high level information, but generally our services are for people in Massachusetts.
Oh, well, thank you, Amy. We'll
You're
see
welcome.
you again. We're excited. Bye,
I appreciate
guys.
that. Stay safe, everyone. Bye.
Bye, guys.
Autism sprinter. Think equity. Yeah. It's time to give the power back to the people. We're fighting to make our beliefs equal. Look at the failed policies and how they treat you. We got strength, yeah, we're far from feeble. This is for anyone with autism or a disability. Time to unite, show them how strong our will can be. Move readily, we're promoting equity. A non-profit platform, that's the recipe. Now throw your hands up, we finally got a winner. Think equity with Autism Sprinter. Now throw your hands up, we finally got a winner. Think equity with Autism Sprinter. It's time to make a change. It's time to stand up for what we believe in. Equality and equity across the board. No matter your race, nation, or creed, disability, or your needs. It gotta be equal. It gotta be right.